Certification increases nurses' knowledge. It ensures that they are up to date on cancer care and helps them to be prepared to effectively manage symptoms associated with cancer and cancer treatment. I think teamwork and being able to utilize effective therapeutic communication skills while caring for people with cancer is something that they will acquire. And not only communicating with people with cancer, but also their caregivers and other members of the interprofessional team.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Oncology Clinical Specialist at ONS, and today we're talking with ONS member Kerstin Scheper, Interim Assistant Vice President at Robert Wood Johnson University Hospital in Somerville, New Jersey, and Oncology Nursing Certification Corporation Board of Directors member, about oncology nursing certification. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks so much for joining us today, Kerstin.
Thank you, Jaime. Thank you for having me on this podcast to discuss oncology nursing certification.
Wonderful. Well, to start things off today, maybe we'll start at the very beginning. Can you help briefly explain what certification is and how that's different than a certificate program?
Sure. I think this is a very important question, as it sometimes is a source of confusion for nurses, patients, and employers. And nurses need to understand what each type of program represents so that they can make the right decision before investing in these programs. We also don't want any unintentional misrepresentation of ourselves as being certified. Professional certification is defined by the Institute of Credentialing Excellence, or ICE, as a voluntary process by which a non-governmental entity grants a time-limited recognition and use of a credential to an individual after verifying they have met predetermined and standardized criteria. The primary purpose of a certification is an assessment, and in the case of the oncology nursing certification, it is a multiple choice examination. The assessment, as it's related to oncology nursing certification, evaluates mastery of knowledge and skills required to competently provide specialized oncology care. Now, a certificate program is different. An example of a certificate program is the ONS chemotherapy and immunotherapy course. This is an assessment-based certificate program, and these types of programs are usually short, non-degree granting programs that provide instruction and training to aid participants in acquiring knowledge, skills, and competencies. So for the chemotherapy and immunotherapy, it provides the knowledge that the nurses need to safely and effectively administer chemotherapy and immunotherapy. These assessments or certificates designate that participants have passed an end of program assessment or test derived from the course objectives. And these programs usually cover a narrow set of knowledge and skills. Example, chemotherapy administration.
Thanks so much for that definition and explaining the difference, Kerstin. I think you absolutely nailed what is a very common question that we receive at ONS, and just a lack of clarity on what the difference is of those two. And also sometimes the question of, well, if somebody has an OCN certification, do they need the ONS ONCC chemotherapy immunotherapy certificate? And so, a lot of words, they all sound the same, but as you've just explained, distinctly different. And it's important, I think, to understand how they're different, how they're not interchangeable, and just what the different kind of scope of knowledge and what requirements are needed to attain one versus the other. So thank you for that brief but very informative summary of that question.
You're very welcome. And I agree. It's very important to be able to share this information, not only with our nurses or our constituents, our ONS members, but also with employers, because very often there's confusion on the employers where they believe that the chemotherapy, immunotherapy course or that certificate really demonstrates that knowledge. And they need to understand that that's really just a very defined or short scope of knowledge and skills.
Absolutely. And you mentioned our most popular program, the Chemotherapy Immunotherapy Administration Certificate. We also have the Radiation Therapy Nursing Certificate. And, we also just on that same tangent a little bit, we do get lots of requests of why are certain things only a certificate and not a certification. Now, we may not be able to get into all the details of the science behind how a certification is developed and validated, but it's very complex. We can at least summarize it in that way. And so while ONCC at times does investigate ways that they could perhaps explore additional certification programs, it's not as simple as just writing a new test and like giving somebody a new credential. There's a lot more that goes into it than that.
I agree.
So let's just get back to professional certification in general. Of course, oncology certification is our specialty of choice, but can you share some of the advantages of nurses who attain professional certification?
Just a little background for me. I have been in oncology nursing for 30 years. I've been in various different roles, both in management and also nursing education. And what I find is that nurses who achieve certification often report an increased feeling of personal accomplishment and satisfaction. And I see right away that increased confidence that they have after they've passed their certification. And they believe that certification validates specialized knowledge, and it gives them this strong commitment to the profession. So many of our nurses already have that strong commitment to the profession, which is really what entices them and makes them want to achieve their certification and to pass any one of the ONCC exams. But it also is reflective of their own professional growth. Certification in many instances promotes recognition from employers, and it's often built into clinical ladders for nurses and potentially, not always, an increase in salary. It was very interesting. I was reading on the ONCC site, and one of the resources that we'll share with you at the end of this program about a 2020 Medscape salary survey indicating that certified nurses who are rewarded financially have an average annual income that is about $10,000 higher than non-certified nurses. And I do know a recent nurse who did just pass her OCN. And in fact, this holds true for her. I was very happy to hear that she is able to be financially rewarded from her organization for passing her ONC test, OCN exam.
That's wonderful. I hope and I wish that all organizations would consider incorporating that as a financial incentive as well. Certainly, that's not the reason that someone would go to all of the effort and commitment to becoming certified in their profession, but it does show that the organization they work for values that and wants to reward them for that. I remember, when I got my very first certification, how exciting it was just to get that little sticker when you get your packet and you get your certificate in the mail for the wall. You get the little sticker you can add to your name badge, and it just feels good. It just feels good to know that I don't know everything. So clearly, I never will know everything, but I know something because I got this in the mail. So, there is that just personal satisfaction of being I did it. And it's a challenging exam, as it should be, but certainly something that I think your colleagues and your patients alike will recognize. Even if patients don't really know what it means, I think they can still make the distinction to this nurse has done something extra. And I think that's very professionally fulfilling, at least for me it was. So how can certification change the way a nurse takes care of patients or works with their professional team?
That's another really important question and something that I thought a great deal about. I see it more and more every day, and I've been in oncology nursing for a long time. Patients want to receive care from nurses who are knowledgeable and have their certification. I do think that they're aware of it. I do believe that patients are aware that nurses can be certified in specialty areas, and they're often looking for that certification. They're looking for that extra certification on the end of their name badge, or they're asking. We get that all the time where we have patients who are asking us, our infusion nurses especially, if they have certification. So I do think it's important. The patient consumer confidence sets the tone for all nurse-patient interactions, right? So the personal confidence and knowledge that the nurse attains from certification, I do believe leads to that improved communication and improved patient outcomes. I think certification can also promote recognition from peers. And that recognition promotes professional autonomy, which in turn enables the oncology nurse to take on more leadership roles and to take on those leadership roles within the interdisciplinary team. And I've seen this firsthand, how it gives our nurses the confidence to speak up and advocate for our patients.
Absolutely. And I think what you mentioned early in your response really struck me about how, as you said, patients, obviously they want qualified, well-trained caregivers as part of their team. And I think while maybe in larger organizations, this falls more under the umbrella of marketing, but I think there should be a mechanism in place to recognize and to promote the certification of the team, of all of the individuals who that patient might come into contact with, whether that's medical assistants who are certified in their area of training, whether that's their nurses and how many nurses that they're working with are certified. And even just from a team celebration, like taking the time to really make a big deal about it, because it is a big deal. And it helps, as you mentioned, it helps elevate the care of the entire team in various ways. And so I think it's important for, at the local level, whether it's the unit or the department, depending on the size of your organization, consider ways that you really can elevate and amplify those nurses that have achieved that certification or their renewal or whatever it is, just to make sure that they feel appreciated for the effort it takes to do that. And that gives patients the opportunity and the awareness to know that their nursing team is well trained and is advancing their professional development as well. Certainly, it's important for physicians to get that highlighted as well as part of patients being able to choose their care providers. But I think, nurses don't always get that same spotlight. So I think we need to be more considerate of how we can do that, even if it's not a marketing campaign that goes across all of social media. Is there a way that we can highlight those nurses at the local level? So when the patient comes into the clinic for their appointment or presents for their infusion appointment, is there a way that we can showcase the level and the talent of the nursing staff?
Jaime, I really do thank you for bringing that up, because it just brings to memory, at my prior organization, we had a wall of fame, right? So we had the certificates, we had the plaques for all of our nurses who had obtained their OCN certification or their advanced certifications, along with a picture and describing their roles. And it was in the hallway for our patients to see. So a lot of pride goes into that. And I do think that those are just small things that we can do to really promote certification for our nurses.
Absolutely. And certainly some of those metrics are captured from a regulatory standpoint, with Joint Commission or other, Commission on Cancer, certain things that they are tracking or trying to assess the number of certified nurses or other clinical team members. I mean, it's not that it's not captured at all, but again, we want the patients to know that. It's reassuring to them. It allows them a chance to congratulate or to thank their nurses for the efforts that they're putting in. So it's just, I think, keeping it local can be even more meaningful. So yeah, that wall of fame is a great idea. So on a broader level, what effects do you see that nursing certification has on the larger cancer care system?
As a nurse in my early career, I didn't really have an appreciation of this, but going through several accreditation surveys and now as a hospital administrator, I understand how ONCC's accredited certification programs meet nationally recognized standards that are reliable measurements of oncology nursing knowledge. And it's just very important for the entire cancer care system to demonstrate a commitment to providing the highest quality of care throughout the cancer care continuum. And our patients with cancer expect and deserve to have nurses with specialized knowledge and experience caring for them. So cancer programs that prioritize certification distinguish themselves in the healthcare market, and certification is a component for gaining distinction by certain organizations such as ANCC magnet recognition and Commission on Cancer, and there's others. It's very important, and it has a very important impact on the cancer care system.
Wonderful. Absolutely. And, I think to myself, it's been a while since I was in undergraduate nursing school, but there usually isn't time in the curriculum to get very deep into oncology nursing. Yeah, you might get a week here or you might get a brief rotation there, but it's generally not into the weeds of oncology care. And so for those of us that come into oncology, it's a very steep learning curve we all recognize and recall. And so it is an opportunity to validate that I done a little extra. I know what I'm doing. I've just been here a while. So I think that that's an important step because it isn't something that is routinely taught to nurses at the undergraduate or even at the graduate level. There aren't very many clinical courses that are specifically focused on teaching oncology. It's kind of, you learn the ropes as you go. And so I think having the oncology certification through ONCC as an opportunity to create that means of validation that our nurses know what they're doing because we promote them to attain that level of knowledge, I think is really important for the entire cancer care system. So what do you see as the largest roadblocks for nurses who are considering going out for their first certification? And how do you think these can be overcome?
What I consider to be the biggest roadblocks, and I think some of those roadblocks might be misconceptions. I'm not sure, but over the last 10 years in my role of nursing education and also in management, I would hear from nurses often who would verbalize really two what they consider to be roadblocks. And one was the cost of certification and the cost of resources to study. And the second was knowing what to study and how to prepare, along with how much time is required or how much time they needed to spend studying, and then finding the time to dedicate to studying, right? So it's, resources, it's financial, it's the time. There are several ways that ONCC has really tried to help to reduce those barriers or those roadblocks for our nurses. So first, what I would tell the nurses would be to check to see if the organization participates in the ONCC free take certification program. So this program helps reduce test anxiety. Nurses who have worked for organizations that participate with this program love it because they will say that it takes away that risk of not passing because they will get a free retake if they don't pass the first time. If your organization does not participate in free take, inquire. Sometimes organizations do not know about it and they just need a nurse to advocate or to push for this program. Another option for those nurses whose organizations do not participate in the free take is the nurse can select the double take option. I spoke to a nurse who recently used this option. It provides a discounted retake option if the nurse doesn't pass the test on the first try. So there is an additional $100 cost for the double take option fee versus paying for the full test fee a second time. You must apply for the second attempt within 180 days of the first test. Many organizations will reimburse the nurse for the full fee once they successfully have passed their certification. And as I said before, I know a nurse that recently chose this option. She successfully passed on the first attempt, but she stated knowing she could take the test again without an additional cost reduced her anxiety level tremendously. And she is now being reimbursed by her organization for the full amount, and she has received an increase in her hourly rate. Now, other areas, because it's not just financial, to overcome some of these barriers could be by creating an environment that encourages studying, talking with other nurses that have recently studied and passed the test, encouraging recycling of resources used by those nurses that recently passed, meaning sharing of books that they may have purchased, looking within your organization and other organizations for OCN review courses, and see if there could potentially, or if there is a test study group, or if your nurse educator in your organization wouldn't mind starting a nurse study group. Those are just some of the examples of ways to overcome some of the barriers that I've identified over the years.
I love all of those options that you recommended. I definitely think either the free take or the double take option does provide nurses who really suffer with test anxiety. It's a real thing. And I think that's a nice way to provide that reassurance that while everyone wants to get it on the first try, even if you don't, it doesn't mean that you are, 100 questions off of being right. I mean, it could have been close, and maybe a second try with a little bit less nerves because you know what to expect can be all that it takes to finally pass that certification. I also love what you recommended about everyone learns differently. Some people like to go solo and just do their own study plan, but I think collaborating and working together with other nurses, whether they're local or thanks to the beauty of Zoom life we now live, you can make those connections with people maybe from across the country. I know on the ONS communities, we often see posts or questions of, do you know of a review course? Who else is studying? What tips do you have? And so making those connections virtually of other people who are working towards the same goal might be a benefit to certain people who like that sort of company while they're studying so that they can learn from others while they try to learn themselves. So all great ideas. What are some of the skills or competencies that nurses can expect to gain by pursuing certification?
So, Jamie, you know what? I thought about this, and there are just so many skills and competencies I think that nurses can gain with the pursuing of certification. So I'm just going to go through a few. So certification increases nurses' knowledge. It ensures that they are up to date on cancer care. And I think what's important is it helps them to be prepared to effectively manage symptoms associated with cancer and cancer treatment. I think teamwork and being able to utilize effective therapeutic communication skills while caring for people with cancer is something that they will acquire. And not only communicating with people with cancer, but also their caregivers and other members of the interprofessional team. Professional development and the ability to advocate for the delivery of high quality patient-centered care. Also, an increasing clinical knowledge and care with the understanding of cancer biology and the ability to apply evidence-based practice. And I mentioned, and I think it's important to mention again, symptom management to effectively care for patients with cancer and to provide the most current treatment modalities and to manage oncology emergencies. So those are all areas that I think will be increased by pursuing certification. Finally, an increased awareness of quality initiatives and care and recognition of the financial impact of cancer and solutions to provide quality care. And also maybe a better understanding because through their studying for the test, they're going to understand some of the ways that we can help our patients to address some of the barriers in access and some of the financial concerns that they're facing, such as financial toxicity. So there's a lot of different skills and competencies that the nurses are going to gain. I think an important point, and I think it'll probably come up in some of the other questions, is that not all oncology nurses work in the same environment, the same oncology environment. So inpatient nurses, ambulatory outpatient nurses, their focus may be a little bit different, but in studying for some of these certification examinations, they're going to need to acquire some more broad knowledge, which is very important because you never know when that broad knowledge is going to translate to a patient or be needed for a patient in their current environment. So I think, there is just so much to gain from pursuing certification.
I agree 100%. That last comment was exactly where my mind was headed. Certification is the equalizer. Oncology has become so complex. It can't help but be a little bit, I don't want to say siloed because that makes it sound like we're not working together. We can still work together, but our specializations sometimes have to be compartmentalized. Maybe that's a nicer word to use, especially when you think of academic centers that have complete teams dedicated to one cancer type or, one group of cancers. Or you look at our nurses who work in infusion, very skilled at all the precision and the detail that comes with how to actually administer therapies. Those nurses that work in the clinic space that are maybe in more in coordination of care or navigation. When I worked in that area, I couldn't tell you how exactly to run this drug on this pump and all the details and vice versa. As you mentioned, inpatient nurses who are dealing with maybe more acute side effects or certain therapies that are only administered in the inpatient setting. Again, we're all doing, not to forget our colleagues in radiation or surgical oncology. I mean, there's just so many areas in oncology that studying for certification can feel very overwhelming if you are already deep into one of those subspecialized areas. But that's what makes it great, is because it does show and kind of prove that you have a generalized knowledge base that can apply to more than just one very specific patient subset, but throughout the care continuum. So I think that can be intimidating for nurses who are already working in one of those more specialized areas, but it doesn't mean it's not still worth pursuing. So I think that's a great point that you brought up. What would you like for oncology nurses to know about certification and the importance of lifelong learning?
There's two things that come to mind with this question, and I just want to let the audience know and you had mentioned earlier on that I am a board of director member for ONCC. Prior to that, I was also on the test development committee. And I'm very proud of the fact that ONCC develops and administers a validated, data-driven certification program. And with the purpose, the goal of validating nurses to have specialized knowledge and experience required for competent performance. And, certification offers both personal and professional rewards to nurses. It promotes professionalism and demonstrates a commitment to oncology nursing and accountability for our own professional development. While that's obtaining the initial certification, we can't forget maintaining certification, because that's an example of lifelong learning, which ensures our nurses are providing up-to-date and evidence-based cancer care. So that's the connection between certification and lifelong learning. If you commit to initial certification and commit to maintaining it, you are demonstrating lifelong learning. So I thought that was the importance that I wanted just to make sure that I really spoke to the nurses about.
Absolutely. And what other specialty could it be more important than to stay current and a lifelong learner than oncology? If I would have just stayed stagnant in what I learned when I first joined oncology 15 or 16 years ago, I would have no idea what I'm doing anymore because these drugs weren't around. So, it's inherent in our specialty to stay current because the science of what we do is moving so quickly, so exciting, overwhelming, important, and it aligns perfectly with what it means to be a certified nurse, is to not only attain that level of knowledge base and be able to demonstrate that, but acknowledging that, knowledge itself doesn't remain stagnant and that we must continue to keep pace with that. As knowledge grows and changes, we also must acquire that new knowledge. So those things go hand in hand. Well, Kerstin, as we wrap up our episode today, we'd like to always ask a few of these quick fire questions just to summarize some of the points that we've covered in today's conversation. So to start that off, what are some common misconceptions about oncology nursing certifications?
So I think what I've encountered the most is the common misconception that it's difficult to maintain the OCN certification. I just want our nurses to know that many nurses may only require the minimum of 25 ILNA points, while the maximum is 100. And I think ILNA can be confusing to some of our nurses. This is something that we often hear at the ONCC booth during Congress. I want to point out that if you're eligible to take the learning needs assessment, you can earn points after you take the assessment, because the assessment is really what's going to determine how many points you need. Do you need the minimum 25 or the maximum 100? And where do you need those points? So I think that that's really what I wanted to make sure that I spoke about today, was that maintaining your OCN certification isn't difficult. You just really want to make sure that you understand ILNA and you understand when you need to start acquiring these ILNA points.
I think that's a great comment, in that ILNA, or the individual learning needs assessment that ILNA stands for. It's important and it's helpful. It serves as a guide. So nurses who are certified don't feel like they're just aimlessly trying to get credits. It helps inform, what areas they get additional education and study in. And I think that's very helpful, so that it does feel like it's directed and intentional and it's addressing their individual needs. What I would add in is the misconception that ONS and ONCC are the exact same thing. We are not.
You're absolutely right.
We are sisters, cousins maybe, but we are separate and we are distinct. And it has to be that way to maintain the validation of the exam. A lot of the offerings that ONS produces in terms of NCPD credits you can earn can be used towards that certification, but officially there is a firewall between the two. We don't share information. So I think that's important. I know at some point before I came on to ONS as staff, you just kind of assume it's all the same thing, but ONCC, ONS, and then our foundation are all distinct entities. So important to keep that in mind.
Thank you, Jaime. And yes, you're right. That is something that I'm always educating and re-educating not only nurses about, but patients and family members and our employers and even physicians about the difference between ONCC and ONS.
So what's something about this topic that's not often discussed, but you wish people knew more about?
I think we touched upon two of the areas. One is how to renew, how to maintain their OCN certification with the ILNA. And the second is also just ways to really overcome some of those barriers, the free take, and finding ways to be able to get our organizations, our employers to participate in the free take.
Wonderful. I think you did a great job of mentioning this earlier. Just the notion that there are resources available both on ONCC's website as well as ONS has offerings that can provide NCPD credits. And we always try to identify which ILNA kind of bucket they would fit into to help promote that process and that to keep that clear for nurses who are trying to find credits for their either certification or their renewal. But as you mentioned, the website has a lot of information about available credits that they can look, not even just with ONS, but with other organizations on the internet that have some trusted programs, as well as if there are study groups or if there's review courses that are being held by certain institutions. Again, those aren't held by ONCC or ONS, but if a certain organization or an institution is having a virtual OCN review course that people can attend or purchase attendance at, I mean, we try to help promote those opportunities for people just for awareness. So yeah, those things are out there. It just kind of takes a little bit of effort to search what works best for you. What additional training or education do oncology nurses need to further understand or obtain their certification?
For every nurse, that could be different because we have oncology nurses in so many different roles, right? So we have the inpatient oncology nurse, we have the ambulatory infusion oncology nurse, we have clinic nurses, triage nurses, research oncology nurses. So for an example, an inpatient oncology nurse may not have as much knowledge regarding clinical trials, which falls under the oncology nursing practice content of the OCN test outline. So my suggestion would be for nurses to thoroughly review the test content outlines for whatever certification test that they are considering, and if possible, connect with nurses in those areas, right? Use them as resources to help with some of that knowledge. And obviously, study.
I love that you mentioned the test outline, formerly the test blueprint. It's a great guide. There is so much to learn. It's overwhelming when you just think of everything's out there. So it does help to sort of organize, categorize what are the different topics and subtopics in those areas so that you can kind of bite off your studying a little bit at a time, smaller bites instead of just the whole book at once. So I think that's very helpful. And I love that your suggestion of connecting with people in those areas that are doing work more specifically or more often in an area of practice that maybe you're less familiar with. I think those are great recommendations. And last question, what are some additional resources for patients or providers who want to learn more about certification?
The oncc.org site, the www.oncc.org site actually has a site that's titled For Patients and Families. And there's also a resource center for employers and advocates. So I think just directing our patients and families and our healthcare, our administrators to those sites would be helpful. And you had mentioned countless others, right? So I think that really that's the first step in getting additional resources for our patients and providers.
Wonderful. Well, Kerstin, thank you so much for your time and your expertise that you shared with us today. Do you have any final comments for our listeners?
I do. Throughout my 30 years, I've witnessed countless numbers of oncology nurses obtain their OCN. I remember their joy and the sense of accomplishment, the pride in their voices and faces when sharing the news. So I would encourage all oncology nurses, when eligible, to consider obtaining certification.
Absolutely. I agree. Thank you so much again for your time and sharing all of your information with us today.
Thank you so much for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.